Hey, you're going.
Okay. Welcome to Group 7 presentation on the U.S. Department of Health and Human Services. Our group members are myself, Penny Martin, Laura Knight, Aaron Murphy, and Sienna Thompson. And the part of my presentation will cover the functions and roles of HHS. It is the mission of the U.S. Department of Health and Human Services to enhance and protect the health and well-being of all Americans. We fulfill that mission by providing for effective health and human services and fostering advances in medicine, public health, and social services. The strategic plan defines its mission, goals, and the means by which it will measure its progress in addressing specific national problems over a 4-year period. The strategic plan for the current years 2014 through 2018, there are 4 strategic goals. Goal 1 being to strengthen healthcare. Goal 2, to advance scientific knowledge and innovation. Goal 3, to advance the health, safety, and well-being of the American people. And Goal 4, to ensure efficiency, transparency, accountability, and effectiveness of HHS programs. The HHS strategic plan includes strategic goals and associated objectives, strategies, and performance goals that focus on these and other major functions of the department. Through its programs and partnerships, HHS provides healthcare coverage to more than 100 million people through Medicare, Medicaid, the Children's Health Insurance Program, and the health insurance marketplace. It promotes patient safety and healthcare quality in healthcare settings and by healthcare providers by assuring the safety, effectiveness, quality, and security of foods, drugs, vaccines, and medical devices. Eliminates disparities in health as well as healthcare access and quality, and protects vulnerable individuals and communities from poor health, public health, and human service outcomes. HHS conducts health, public health, and social science research with the largest source of funding for medical research in the world, while creating hundreds of thousands of high-quality jobs for scientists in universities and research institutions in every state across America and around the globe. HHS leverages health information technology to improve the quality of care and use HHS data to drive innovative solutions to health, public health, and human services challenges. It improves maternal and infant health, promotes the safety, well-being, and healthy development of children and youth, and supports young people's successful transition to adulthood. HHS promotes economic and social well-being for individuals, families, and communities, including seniors and individuals with disabilities. It supports wellness efforts across the lifespan, from protecting mental health to preventing risky behaviors such as tobacco use and substance abuse, to promoting better nutrition and physical activity. It prevents and manages the impacts of infectious diseases and chronic diseases and conditions, including the top causes of disease, disability, and death. It prepares Americans for, protects Americans from, and provides comprehensive responses to health, safety, and security threats, both foreign and domestic. HHS serves as responsible stewards of the public's investments. And our next slide will be presented by Aaron for Laura Knight.
All right, so we are going to talk about the organization of the human health, health and human services. There's a deputy secretary, which is over everything. And then they have subgroups: assistant secretary for health, assistant secretary for preparedness and response, assistant secretary for legislation, assistant secretary for planning and evaluation, assistant secretary for administration, assistant secretary for public affairs, and assistant secretary for financial resources. Then Public Health Service, Public Health Service Commission Corps. Agency for Healthcare Research and Quality, Agency for Toxic Substances and Disease Registry, Centers for Disease Control and Prevention, Food and Drug Administration, Indian Health Service, National Institute for Health, and Mental Health Services Administration. Next. Led by Assistant Secretary is Preparedness and Response, Legislation, Planning and Evaluation, Administration, Public Affairs, Financial Resources. Additional departments are Office of the Inspector General, Office of the General Counsel, Administration for Children and Families, Administration for Community Living, Administration on Aging, and Centers for Medicare and Medicaid Services. Then there
You skipped one.
are the regional offices throughout the U.S. in a total of 10 regions. First region, the main office is in Boston. The second region is in New York. The third region is in D.C. The fourth region is in Atlanta. Fifth region is in Chicago. The sixth region is in Dallas. The seventh region is in Kansas City. The eighth region is in Denver. The ninth region is San Francisco. And the 10th region is Seattle. So now we're going to talk about some of the actual specific people that are in charge of the different areas, which we've already talked about, and somewhat what they do in general. So there's the main secretary, which is Thomas E. Price, which is over everything out, over the whole HHS, basically. And we have the acting deputy secretary, which is also Colin Barrows, which is also over pretty much everything. So they work together very closely. There's an acting assistant secretary for administration, which is Christian Major. Provides leadership for HHS departmental administration, including human resource policy, information technology, and departmental operations. Then the acting assistant secretary for financial resources, which is Norris Cochran, provides advice and guidance to the secretary on all aspects of budget, financial management, grants, acquisition management, and to provide for direction and implementation of these activities. And there's the acting assistant secretary for global affairs, which is Mitchell L. Wolf. He oversees the International Relationship Division of the OGA, providing guidance and leadership for OGA's bilateral work, operations, and supervision of U.S. health attachés stationed in India, Brazil, South Africa, China, Mexico, and Geneva. Also works with the World Health Organization. Then we have the Acting Assistant Secretary for Health, which is Don Wright, which optimizes the nation's investment in health and science to advance health equity and improve health of all people. Leads development of wide public health policies and oversees the 12 offices and also the Surgeon General's office and 11 advisory committees. Next. Then we have the Secretary for Legislation, Barbara Pathrow, which is the primary link between the Department of Health and Human Services and Congress, so just the in-between. Then we have the Secretary for Planning and Evaluation, which is Lena Bush, Principal Advisor to the Secretary of the U.S. Department of Health and Human Services. Then we have the Acting Assistant Secretary for Preparedness and Response, which is George W. Kroc, which is the lead in the nation in preventing, preparing for, and responding to adverse health effects of the public health emergencies and disasters. And we have the Acting Assistant Secretary of Public Affairs, William Hall, which provides the centralized leadership and guidance for public affairs activities within the HHS staff and operating divisions and regional offices. Then we have the Chair of Departmental Appeals Board, which is Constance B. Tobias, provides impartial and independent reviews of disputed decisions under more than 60 statutory provisions. We have the Acting Director, Office for Civil Rights, Robin Sue 4Bs, directs in the areas of civil rights, including information and privacy security. We have the Office of Inspector General, Daniel R. Levinson. His mission is to protect the integrity of the Department of Health and Human Services programs as well as the health and welfare program beneficiaries. Next. Let's see. And then we have the Acting General Counsel, Jeffrey Davis. It's a legal team for the Department of Health and Human Services, providing quality representation and legal advice on a wider range of highly visible national issues. Then we have the Chief Administrative Law Judge for the Office of Medicare Hearings and Appeals, which is Nancy Griswold, which deals with hearing programs, hearing appeals arising from individual claims from Medicare coverage and payment for items and services furnished by the beneficiaries or enrollees under Medicare A, B, C, and D, Part A, B, C, D. The Acting Director, Intergovernmental and External Affairs, IEA, Nikki Bratcher Bowman, serves as the department's liaison to state, local, and tribal governments and non-governmental organizations. Then we have the Surgeon General, Vice Admiral Vivek H. Murthy, responsible for communicating the best available scientific information to the public regarding ways to improve personal and public health. And finally, we have the Acting National Coordinator for Health Information and Technology, John White. He basically leads national health IT efforts, charged as a principal federal entity to coordinate nationwide efforts to implement and use the most advanced health information technology and the electronic exchange of health information.
So the CDC is just one of the programs under the Department of Health and Human Services. It's a large program. Let me just go ahead and read through. The CDC mission statement is to protect America from health, safety, and security threats, both foreign and in the U.S., whether diseases start at home or abroad, are chronic or acute, curable or preventable, human error or deliberate attack. CDC fights disease and supports communities and citizens to do the same. CDC is responsible for controlling the introduction and spread of infectious diseases and provides consultation and assistance to other nations and international agencies to assist in improving their disease prevention and control, environmental health, and health promotion activities. To accomplish its mission, the CDC identifies and defines preventable health problems and maintains active surveillance of disease through epidemiology and laboratory investigations and data collection, analysis, and distribution. The CDC 24/7 saves lives protecting people. In case you might be wondering what the CDC stands for, it's the Center of Disease. Let me advance. Okay. The Agency for Toxic Substance and Disease Registry. The mission of the ATSDR is to prevent or mitigate the adverse human health efforts and diminished quality of life that results from exposure to hazardous substances in the environment. It works closely with state, local, and other federal agencies to eliminate illness, disability, and death that result from exposure of the public and workers to toxic substances at spill and waste disposal sites. And this is just a brief overview of the Department of Health and Human Services. is the U.S. government's principal agency for protecting the health of all Americans and providing essential human services, especially for those who are least able to help themselves. HHS is responsible for almost a quarter of all federal outlays and administers more grant dollars than all other federal agencies combined. The department manages programs that cover a vast spectrum of activities that impact health, public health, and human services outcomes throughout the lifespan. This is just our Works Cited, and thank you for listening.